Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OIT training. Welcome back to Magic Pill session. The topic or the subject what we are going to discuss is child health nursing and the repeatedly asked questions from the competitive exams we are going to discuss, and also additional golden points and the key points we are going to discuss which is related to that particular question. One more information I would like to convey here. In Metier International Academy, the branch which is located in Saket, we have launched online as well as offline batch. We are targeting JIGMAR, RRB, ESI as well as mainly NORCET 8. So whoever willing to join as early as possible, please come and approach us. And if you want to join, even you can comment in the comment section. And one more important point, in Pondicherry, Tamil Nadu, near to Tamil Nadu, Pondicherry, there also we are having a branch. So in Pondicherry, also online, offline session is going on. Whoever willing to join as early as possible, please come and join with us. Okay, fine. So let's begin the session with your motivational thought. Opportunity does not happen. You need to create them. Opportunity will never come to you. Okay, we need to approach the opportunity. Whenever the opportunity approaches us, please grab it. Okay, so whenever the approaches comes, please grab it. Underline the word. Okay, don't miss the opportunity. With this motivational thought, let's begin the session. As I mentioned already, the subject what we are going to discuss is child health nursing. And if you like the video, please like it, share it. And if you have any doubts anywhere, please drop your message in the comment section. The first question what we are going to discuss is chronic malnutrition is measured by. It is a direct question. Okay. Chronic malnutrition is measured by. So let's see the options. Weight, height, height of age, weight for age, and mid-arm circumference. So 4 options they have given here. Weight by height, height for age, weight for age, mid-arm circumference. Among these 4 options, which is related to chronic malnutrition. How we are going to measure the chronic malnutrition? Okay, so this is the question. And here the right answer is going to be height by age. We are going to measure the chronic malnutrition by height for age. What is that? Height for age. So how it is possible? Why I have selected height for age for chronic malnutrition? Why we need to measure the chronic malnutrition by height for age? For that, you should understand the key points. So here I am going to discuss the golden points with you. Actually, the malnutrition, it is broadly classified into 3 types. How many types? 3 types. Acute malnutrition, chronic malnutrition, and acute and chronic malnutrition. Okay, so this is how it is categorized into 3 types: acute, chronic, acute, and chronic malnutrition. Okay, so in this question they asked about chronic malnutrition. We will be discussing about that. Let's go one by one. Okay, first let's discuss about the acute malnutrition. Malnutrition means you know that the patient or the kid or a child is not taking adequate intake. So the child is suffering from malnutrition. It is categorized into acute, chronic, and acute chronic. Okay, first let's discuss about the acute malnutrition. You can see here very clearly. Let me on the cursor. Yes. So in acute malnutrition, the key point what you're supposed to remember is always you should know the key points. Okay. So the key point what you're supposed to remember is muscle wasting. In acute malnutrition, what will happen? Muscle wasting will be there. Okay. So whenever there is a muscle wasting, definitely the weight loss is going to get happen. Yes or no? The muscle wasting is there means the weight loss is going to happen, right? So you have to measure the acute malnutrition by weight for height. Okay, you have to measure the acute malnutrition by weight. How you have to measure? By weighing the child. Okay, so that's why 2 key points you have to remember in acute malnutrition. Muscle wasting will be there. So we are measuring the acute malnutrition by weight for height. First point. Okay, the second point what we are going to discuss is chronic malnutrition. This is related to the question. In chronic malnutrition, stunting growth will be there. In acute malnutrition, muscle wasting, that is weight loss is there. Whereas in chronic malnutrition, height is decreased. Decreased in the sense the growth is not there. The stunted growth is present. Okay, so the growth is affected means definitely what we are supposed to do? We have to measure the height. Okay, acute muscle wasting, so we are measuring the weight. Chronic stunted growth, so we are measuring the height. Okay, so here we are measuring the height for age. There weight for height, here height for age. Okay, and the third very important thing, both combination is there. It is like a combo, acute and chronic malnutrition. Both combo is present. So in this situation, what we supposed to do here, wasting is also there because acute malnutrition means muscle wasting is there. Chronic malnutrition means stunted growth will be there, right? So how to measure this? So here we are measuring by weight for age. Weight for age. Okay, so three things are there. The first one, acute malnutrition, muscle wasting, weight for height is the key point. Chronic malnutrition, stunted growth, height for age is the key point. Acute and chronic malnutrition, muscle wasting and stunted growth is there. So here we are measuring with weight for age. So wherever I have underlined the key point, right, please make a note of it. If you have paper and pen, please write it out. These are all the key points. Okay, so many times from here the question was asked in the exams. Okay guys, so this is about the chronic malnutrition. So here the answer is B, height for age. Okay, fine. So the next question what we are going to discuss is another important question, repeatedly asked question. Okay, in the question itself, two key points are there. So listen and focus. A 2-year-old child has respiratory distress, stridor, fever. The fever is sudden onset. Okay, on examination, with the laryngoscope, they are using the laryngoscope and they are examining the oropharyngeal region. Okay, on examining the laryngoscope, the examiner saw red swollen epiglottis. Okay, red swollen, the epiglottis is red in color. Okay, and then they have taken the x-ray. In x-ray they have seen term sign. Term sign, underline the key point, x-ray, term sign. I will be showing the image. Okay, so two key points is there. The first thing is swollen epiglottis, second one is term sign in the what, x-ray. Okay, fine. So now they concluded that there is a infection in the epiglottis. So here the question is, which organism is most likely to be associated with this condition? Which organism is mostly likely to be associated? They are asking for the organism causing this epiglottis. Okay, so let's see the options. Parainfluenza virus, Haemophilus influenza, type B virus, Staphylococcus aureus, and the last one is Pseudomonas. Among these four, which is more frequently or prominently causing the epiglottis? This is the question. Okay, so here the right answer is option B, Haemophilus influenza type B virus. Okay, see one point you also remember here. Usually the Haemophilus influenza type B virus, for preventing this infection or preventing this virus infection, we used to give Hib vaccine. Hepatitis B, it's not hepatitis, influenza, Haemophilus influenza type B vaccine we supposed to give to the children. At least 3 to 4 doses we are giving to the children, right? So in this question, you have to check whether the word vaccination is present or not. In this, they doesn't mention anything about the vaccination. In that case, we can go for the option B, Haemophilus influenza type B. Okay, so let me explain along with the golden point so that it will be easy for you to understand. Two things you have to keep in mind, guys. That is unvaccinated children and vaccinated children. See, vaccinated means Hib vaccine, Haemophilus influenza type B vaccine. Okay, if the child taken Hib vaccine, then the epiglottis will be caused by Staphylococcus pneumonia. Understand the point? Yes, already the child is vaccinated with Hib vaccine, Haemophilus influenza type B vaccine means, then the chance for getting epiglottis is because of Staphylococcus pneumonia. Suppose the child is not at all vaccinated, underline the word not at all vaccinated. In that situation, what organism will cause epiglottis? Haemophilus influenza virus type B. Okay, it depends upon vaccinated and unvaccinated word. Suppose in this question, they doesn't mention anything about vaccination or unvaccination. That time we can go for what? Type B, Haemophilus influenza. If they doesn't mention anything about vaccination, directly go for Haemophilus influenza. If they mention vaccinated child or unvaccinated child, accordingly you have to go. Vaccinated child, the chance for getting epiglottis is because of Staphylococcus pneumonia, and unvaccinated child, Haemophilus influenza virus type B. Okay, so for this question, the right answer is going to be option B. Okay, fine. So let's move on to the next question. So before going to the next question, I said term sign, right? So here you can see this is the normal one. This is the epiglottis. Can you see the epiglottis, guys? So this is the epiglottis. Okay, fine. So this is the normal one. Whereas in abnormal condition, you can see the thumb-like shape of the epiglottis. The epiglottis is actually swollen, okay, and it is become like a thumb. Epiglottis swollen and it become like a thumb. That is called as what? Thumb sign. This is the normal epiglottis and this is the thumb sign epiglottis. Clear, guys? Yes? Go ahead. The next very important question is, this question asked so many times in the exam related to trisomy. There are so many trisomies, right? Trisomy 21, trisomy 15, 18, 13. So like that, many trisomies are there. And here, what is the important point you supposed to remember is other name of trisomies. Okay, other name of, for example, trisomy 21 is called as what? Trisomy 13 is called as what? Trisomy 15 is called as what? So these type of questions are very, very common in the competitive exams. Okay, so here in this question they asked about trisomy G. Trisomy G is due to which number of chromosomal defect? Trisomy G is due to which number of chromosomal defect? Actually, they are asking other name only in this question also. Okay, let's see the option. Trisomy 21, trisomy 18, trisomy 13, and the last one is trisomy 15. Trisomy G is the other name of what? 21, 18, 13, or 15? And here the right answer is going to be 21. Trisomy G is also called as 21. That is trisomy 21, Down syndrome. Okay, trisomy G also called as trisomy 21. It is nothing but Down syndrome. Clear, guys? Let's discuss the key points also, because those key points are very, very important, because these golden points are repeatedly asked in the exams. So focus here. So trisomy 21. First, let's discuss about trisomy 21. Okay. So trisomy 21, as I mentioned already, it is also known as Down syndrome, also known as trisomy G. Trisomy G, also known as Mongolian syndrome. So how many names are there? 4 names. Trisomy G, trisomy 21, Down syndrome, Mongolian syndrome. 4 names are there. Right? Fine. So here what is happening? In Down syndrome or trisomy 21, there is an extra copy of chromosome 21. Nowadays, the examiner is very, very clever. They will be asking the image-based question. They will not give this type of statements. If they are asking image-based questions, they can ask like this. Look into this. See, they will be giving only this chromosome. They will not give the answer. See, the answer is already mentioned here, Down syndrome, trisomy 21. They will not show this. Okay, just they will be giving this chromosome. All these things are chromosomes. Okay, in the chromosome you can see all the chromosome, it is only 2. It is coming in pairs. It is coming in pairs. Okay, so from first to 22, you can just observe carefully. Everything is coming in pairs, only 2 in numbers. But if you see 21, that is trisomy 21, it is 3 in number. That is extra copies of one chromosome is there. Okay, so they can give questions like this also. Just they will give this chromosomes. Okay, and here they will point out and say extra pair of chromosome is present in 21st pair. So what is this disease called as? Then we have to say it is a trisomy G or Down syndrome or trisomy 21. Okay, so this is how they will manipulate you. Okay, so you have to be very clever in answering the questions. Okay, so image based over, and the golden point is also over. Let's discuss the next key point, that is trisomy 18. Trisomy 21 we discussed. Trisomy 18, the other name of trisomy 18 is Edwards syndrome. What is that? Edwards syndrome. Okay, so trisomy 18 is also known as Edwards syndrome. Here also 3 copies of 18th chromosome is present. Actually 2 chromosomes should be there, but instead of 2 chromosomes, 3 copies of chromosomes are present in the 18th one. You can see here, this is the trisomy 18, Edwards syndrome. This is the normal 18th chromosome. Only one pair is there. Only one pair is there, right? Whereas abnormal chromosome, 3 pairs are there. This is how they will ask the question. Okay, so 3 pairs in the sense 1 extra copy. We should not say 3 pairs. Okay, we have to say 1 extra copy of chromosome is present. Okay, so this type of 1 extra copy of chromosome is present means in 18th chromosome, it is called as trisomy 18 or Edwards syndrome. Okay, same way in Patav syndrome, you can see here the 13th pair of chromosome is having 1 extra copy. 13th pair of chromosome is having one extra copy. If it is so, means that is called as what? Petaev syndrome. Okay, otherwise trisomy 13. So three important things we have covered here. Trisomy 21 also called as Mongolian, also called as Down syndrome, also called as trisomy G. And this is trisomy 18. Here 18th chromosome is abnormal, having extra one copy, right? Fine. So it is also called as Edwards syndrome. And this is trisomy 13. It is also called as Petaev syndrome. Okay, here you can see one extra copy in the 13th chromosome. Clear? Yes. So these are all the three important things. And one more is there, that is 15, trisomy 15. It is also called as mosaic trisomy. Mosaic trisomy. Okay, here the 15th chromosome is affected. If this mosaic trisomy is there, means mainly it will affect the craniofacial dysmorphism. The cranium and facial dysmorphism means abnormal shape will be there. Apart from that, it will affect the heart, especially the septum. Ventricular septal defect, atrial septal defect will be there in the mosaic trisomy. Okay, so in this question, which is very important, other names are important, and also this type of images they can give in the exam, and they can ask what is the disorder, what is the disease, or what is the chromosomal abnormalities. Okay, you can expect this type of question in the future, guys. Fine. So next, move on to the another important question. How can you tell if your baby is getting enough milk when breastfeeding? Direct question. Once again, I will repeat. How can you tell if your baby is getting enough milk when breastfeeding? Okay. So four options they have given here. Baby has several bowel movements. If the baby is getting adequate feeding, definitely several bowel movements will be there per day. Okay, even 3 times, 2 times the baby will void the or pass the stool, right? And second option, baby has at least 6 wet diaper a day. Yes, taking adequate feeding means wet diapers will be there. At least 6 will be there, right? Baby steadily gains the weight. Definitely the baby weight will also gain, right? So all these three options are correct, even though it is a simple question. The additional points are very important. I'm going to discuss that. Okay, so here the right answer is going to be, as you all know, that it is all of the above. So which is the right one here? All of the above is going to be the right one. Fine. So let's discuss about the golden points one by one. Okay, the first golden point is, what is exclusive breastfeeding? After the delivery of the baby, till 6 months, fully the baby will be fed with the breastfeeding. Only we are giving breastfeeding to the baby for up to 6 months. That is called as what? Exclusive breastfeeding. Okay, sir. So when the breastfeeding should start? You are saying that from the 0 day to 6 months, we have to give the breastfeeding, right? So, but when we have to start? At what time we have to start the exclusive breastfeeding? This question is commonly asked in the exams. I think 3-4 times asked in the exams. Okay. For that, these golden points are mentioned here. Listen carefully. After delivery, when the breastfeeding should start? In case of normal term vaginal delivery. That is a key point. In terms of normal term vaginal delivery, when we need to start the breastfeeding. If the question comes like this, means less than half an hour. We have to search for the option what? Less than half an hour. Within half an hour, we have to start the breastfeeding in case of term vaginal delivery. Clear? And the next important point is, if the baby is born by lower segment cesarean section, LSCS, when we need to start the breastfeeding. Less than 4 hours or within 4 hours. Within 4 hours, we have to start the breastfeeding. In simple, for a term vaginal delivery, again I am telling, even we have to search the option like as early as possible. If half an hour, within half an hour option is not there, means even we can search the option for as early as possible. I'm talking about term vaginal delivery. Okay, so two key points which is related to term vaginal delivery: as early as possible or less than half an hour. In case of LSCS, within 4 hours. Clear? Exclusive breastfeeding means 0 to 6 months. Okay, the next thing what we are going to discuss is feeding and weeks of gestation. If the baby is born on 34th weeks of gestation, what type of feeding we should give? If the baby is born before 34 weeks of gestation and sucking reflex is absent, swallowing reflex is present. Sucking reflex is absent, swallowing reflex is present means what type of feeding we have to give. If the baby is born before 31st weeks of gestation, what feeding we have to give? So this type of question is already asked in the exams. Okay, you can see here at what weeks of gestation direct breastfeeding can be provided. Direct breastfeeding can be provided. Okay, fine. See, direct breastfeeding is only applicable for baby who has good sucking and swallowing reflex. Underline the key points: good sucking and swallowing reflex. Is that clear, guys? Yes. For which term baby, for which gestational term baby will be having a good sucking and swallowing reflex? If the baby is born more than 34 weeks of gestation. If the baby born after or 34 weeks of gestation or more than 34 weeks of gestation, if the baby is born means definitely the baby will be having good sucking and swallowing reflex. For those babies, we can give what? Direct breastfeeding. Okay, suppose baby born before 34 weeks of gestation. In that case, only swallowing reflex will be present, sucking reflex will be diminished, decreased. When before 34 weeks of gestation, if the baby is born means the sucking reflex is going to be decreased or diminished and swallowing reflex will be present. In that condition, we can give expressed breast milk. We will be discussing about the expressed breast milk in detail in the next slide. Okay, that is very, very important one. So expressed breast milk, the milk will be expressed from the breast and we will be giving to the baby in katori or paladai. Okay, fine. If the baby born before 34 weeks, expressed breast milk can be given because sucking reflex is absent, swallowing reflex is present. The third one is suppose if the baby is born between 29 to 31 weeks of gestation. 29 to 31 weeks of gestation. Now the sucking reflex is also absent, swallowing reflex is also absent. In that situation, the only option is NG feeding. NG, nasogastric feeding. Okay. You can ask one more question, sir. Suppose if the baby born before 29 weeks of gestation, what should do? IV fluids. Before 29 weeks of gestation means only IV fluids. Okay, guys. So this is the feeding and weeks of gestation. And the next, yes, as I mentioned already, expressed breast milk storage period, time period. How long we can store the expressed breast milk? Actually, guys, it is categorized into three types. That is in room temperature, refrigerator and freezer. In room temperature we can store for 8 hours, refrigerator we can store for 24 hours, and in freezer we can store for 3 months. Clear? Very important, repeatedly asked questions, guys. Focus. Okay, and the next important thing what we are going to discuss is mother milks and its types. Okay, mother milk and its types. As you all know, after the delivery of the baby, immediately the colostrum secretions will be there. That is the first milk. It is like a first vaccine for the baby because it is having immunoglobulin IgA and it is rich in protein. That is 7.1 gram of protein is present in the colostrum. For the first 3 to 4 days, the colostrum secretion will be there. It is a thick yellow color milk secretion. Okay, for 3 to 4 days, rich in immunoglobulin A as well as protein. That is 7.1 gram of protein is present. Followed by that, then second milk, what is coming from the mother is transitional milk. First 3 to 4 days, colostrum. Followed by that, up to 10 days, 7 to 10 days. Okay, 7 to 10 days followed by the colostrum. The second milk, what is ejecting from the mother is transitional milk. What is that? Transitional milk. First colostrum milk, second transitional milk, and the third one is mature milk. What is that? Mature milk. In mature milk, it is broadly classified into two types, that is fore milk and hind milk. Fore milk means while starting the feeding, the baby will be getting a fore milk. It is just to satisfy the thirst of the baby. Followed by the fore milk, while drinking, the baby is getting the feeding. During feeding, two types of milk will come. The first milk is going to be the fore milk. It is used to satisfy the thirst. And the second milk is hind milk. It is used to satisfy the hunger. Okay, fore milk for satisfying the thirst and hind milk for satisfying the hunger. Okay, fine. And the hin milk, one important point you're supposed to keep here, that is rich in fat. Hin milk is rich in fat. Clear, guys? So colostrum, translational milk, mature milk further classified into fore milk and in milk. Okay, I have explained the purpose, duration also. Fine, guys? Okay. So the last very important recently asked question, it is related to good attachment of baby. What is that? Good attachment of baby. It is related to breastfeeding only. So I have included here good attachment of baby. When the mother will get the good attachment from the baby. 5 options you have to keep here. The first thing, exclusive breastfeeding. How early the mother is starting the breastfeeding. That is the first point. Okay, it will create the bond, good attachment from the baby. Okay, the first one is while breastfeeding. Okay, and while breastfeeding also, how she is breastfeeding. What is the position? What is the position of the chin of the baby? See, here you can see the chin touches the breast tissues. The chin of the baby should touches the breast tissues. Okay, there should not be any gap. The chin of the baby should touches the breast tissue. That is the second point. And third one is wide open mouth. The mouth should be wide enough to suck the milk from the areola. Okay, that is the third point. And fourth point, the areola should be totally covered by the baby mouth. Okay, the areola should be covered by the lips of the baby. That is upper lip and lower lip should be totally covered the areola for getting the proper feeding. And the last one is especially the lower lip. It should come everted. Everted means the lips of the lower lip should be come outside to cover the areola and suck properly. Clear? So all these points are very, very important. It will create the good attachment of the baby. If you are getting any question which is related to good attachment of the baby, you have to search for these key points. Okay. The last question what we are going to discuss is neonate has difficulty in maintaining the body temperature. It is related to body temperature. However, they have several mechanisms to help to maintain the body temperature. Okay, actually there is a neonate, it is having difficulty in maintaining the body temperature, but still it is managing to maintaining the body temperature. Okay, it is an except question which include all except. Okay, let's see the options. You understand the question, right? Baby is having difficulty in maintaining body temperature, but somehow it is maintaining the body temperature except. Okay, so here we have to search for what are all the way it is maintaining the body temperature and which is not related to this question. Okay, so 4 options they have given here. Flexed fetal position, definitely flexed fetal position will create a warmthness, right? So that is a related to the correct one. Second one, hepatic insulin stores, it is not at all related to the question, so that is the answer here. Okay, it is the except question, so option B is the answer. Hepatic insulin stores doesn't match this question. Brown fat metabolism is very, very important because in babies they will be having brown fat. It is used to prevent from the hypothermia, right? So brown fat metabolism is there, that is related to the question. Peripheral vasoconstriction, if you see hypothermic babies, they will be having peripheral vasoconstriction. Okay, so the acyanosis will be there, peripheral acyanosis. Okay, the hands and the foot, everything will become bluish discoloration because of the contraction of the blood vessels, peripheral contraction of the blood vessels. Okay, cyanosis will be there. Fine. So peripheral vasoconstriction is also related to the question. So option A, C, D, all are related to the question. Which is not related to the question? Option B, that is hepatic insulin stores. Okay, guys. So this is the right answer here because it is an except question, and let's see the key points. Here, 4 points you have to keep in mind whenever you undergoing any question which is related to temperature. Okay, especially hypothermia related one. So the normal temperature for the neonate is 36.6 to 37.5 degrees centigrade. It is a direct question, memory based things, you have to memorize it. Okay, for mild hypothermia it is just 36 to 36.4 centigrade, moderate hypothermia 32 to 35.9 centigrade, and severe means less than 32 centigrade. Okay guys, so if you understand this concept, you can easily answer the questions which is related to hypothermia. Okay, fine. So far we have discussed the repeatedly asked questions from the child health nursing, and also we have discussed the golden points with the rationals. If you have any doubts, you can drop your message in the comment section. And if you like the video, please like it, share it. And once again, as a reminder, I would like to say this. So for in Delhi Saket branch, we are opening the offline evening batch. Okay. So as early as possible, please come and join and attend the session. See, NORCET 8, we are focusing. Mainly NORCET 8, we are focusing. Okay, fine. And if you want to, if it is not possible to attend offline, even you can attend online. So online session is also going on. Okay, so the class before Jan 10, you can join anytime. Okay, if it is not possible to join in Delhi, you can even join in Pondicherry. So in Pondicherry also online offline hybrid classes are going on. Okay, so you can join and attend the session. And thank you very much for watching the video patiently, guys.